Hi, everyone. My name is Dr. Mili Kaggwa, and I work as a Senior Technical Advisor at Population Services International, also known as PSI, where I support a service delivery portfolio that spans over 30 countries in family planning, sexual reproductive health, maternal and newborn health. My project is about creating transformative quality of care approaches that foster agency of women and empower women and girls. So I set out with the aim of putting women at the center of their care and transforming the existing quality of care approaches at Population Services International is one way in which we can pivot to see that we have gender transformative approaches that advocate for women and girls in their healthcare. In the meantime, while also building the quality of care systems so that we can be able to foster women's agency to seek healthcare that meets their needs. Women have unique healthcare needs that are inherently undermined by some biases and practices. And this actually impact on the patient's care and also with the satisfaction of their care. So if these are not addressed, women will continue to fail to access care that meets their needs. I just want to talk about that picture. In that picture last month, our team was in Pakistan, and I took this picture at a community gathering for women. But this picture shows you, just looking at it, how unique the gender norms, for instance, in Pakistan are compared to any other community like East Africa. You would not find a man sitting in that community meeting while women's health is being discussed. And yet men also are very influential in the healthcare seeking behavior of women in Pakistan. So one size cannot fit all. And my project sets out to see how to strengthen the knowledge, practices, attitudes of healthcare professionals and our projects to make sure that our interventions are transformative and help improve the health of women. So my leadership journey has been interesting. Given that this project had no budget resources, I had to work within our existing resources and to be very creative in the use of the available resources, which is really mainly my level of effort and expertise that we have at the global level at PSI. This meant the leadership, using the leadership skills that I have learned during our touch points to create buy-in for the project so that it's included in the quality of care approaches and systems at my organization. So I nestled the project into our existing framework. And at the global level, at PSI, our quality of care team will develop the framework in which all our quality of care service programs will then adopt or implement based on what is in their countries. So the interventions, as you see there, which I felt these interventions, if implemented, will lead to certain outcomes, and eventually shall have the outcomes and my vision, which will occur even after this project has ended. So one of the interventions was to develop a gender standard and indicators and have those included in our quality of care plans, in our approaches, in our systems, and then at each point, make sure that we have a gender transformative training curriculum that will roll out. And we started off with looking at Pakistan, where we did a gender one-on-one training, but we plan to do this in Benin, hopefully in Nigeria and Ethiopia as the year goes by. And then among the outputs then would be countries having quality of care plans that have incorporated gender standards and norms, and those can be measured as we measure usually our quality of care every year as a platform. And then, of course, with that, you'll have improved client experience of care and also increased high quality care that meets the patients at their center, where it meets their needs. So what has been the progress to date? This table shows my early results and ongoing activities for 2023. And to achieve these results, I had to use and adapt my influencer styles to be sometimes assertive, sometimes to negotiate, and sometimes to bridge, while also using the leadership pillars that we've learned of being authentic, inclusive, strategic, and impactful to be able to achieve the long-term results. And as you can see in quarter one, I've been able to get buy-in, I've been able to develop the standards and indicators, and we've had a pre-test, see if they can work. And we're still working to see that in quarters 3 and 2 and 3, we'll be able to update these, disseminate them to our teams, and then monitor them probably in quarter 4 of 2023, while reviewing the action plans that countries submit to us. Yes, so what next after the project? So much work has already been done. I think lots of work is being done to improve women's health, but unless we look at health interventions for women and girls through the gender lens, we shall not be able to meet women's needs, and there will always continue to be a gap. So my call is for everyone on this call, in whichever organization you work for, to continue to be innovative and to adapt any existing approaches to be more gender inclusive and transformative, so that we're able to meet women at the center. This picture is a picture I took again in Pakistan at one of the health areas with the women health leaders, who then were trained. Some of them have been trained in just having a gender transformative, just the definitions. What is gender transformative? What is not? And hopefully we'll be able to see, to continue to promote organization-wide changes that meet women's needs. Thank you.